All right, good afternoon, everyone, and thank you for being here. Today, we're here to share an important update on our city's mask and vaccine mandates. Excuse me. Joining me in this effort are CDPH Commissioner Dr. Allison Arwady and CDPH Medical Director Dr. Geraldine Luna. Since COVID-19 arrived in Chicago, now almost 2 years ago, the city's mitigation measures, including mask and vaccine mandates, have been guided by the same core metrics: COVID-19 cases per day, test positivity, and overall hospitalizations, and separately, the number of ICU beds occupied. These metrics are windows into the depth and rate of community spread and the stress on our healthcare system. By adjusting our mitigation measures based on these metrics, we've been able to protect and save the lives of our residents, as well as prevent our healthcare system from collapsing. Over these last 2 years, we've had to make very tough, literally life and death decisions, guided by the science and data. We have endeavored to be as transparent as possible. And while some may not have agreed with every decision, make no mistake, every call that has been made has been guided by the science, with robust engagement of relevant stakeholders, and always with a focus on saving lives. Using these same core principles, back in early January, the Public Health Department issued an emergency order, which, among other things, made proof of vaccination mandatory in certain recreation spaces. Recall that back in December, we were in the throes of the Omicron surge. We knew that Omicron variant spread very fast, was super contagious, and potentially very lethal. We imposed new mitigation interventions when we saw case rates explode, positivity rates skyrocket, and we feared a crushing new burden on our healthcare system. All of the metrics we follow moved dramatically in the wrong direction. But today, we see a dramatic swing in these same metrics in a different, better direction. Currently, our metrics continue to trend in the right direction, and Dr. Arwady will share more on that in a moment. And thanks to the ongoing progress the city is making in coming out of the Omicron surge, we are announcing today that we will remove the indoor mask mandate and the vaccine requirement for certain public locations on February 28th, this coming Monday. This is in alignment with the state's previously announced plans to lift the statewide indoor mask mandate on that same day. And let me reiterate that this removal of restrictions is only applicable to certain public locations. Masks will continue to be required on public transit, in healthcare settings, and other congregate spaces as per federal mandates and CDC guidance. For congregate spaces with lower vaccination rates, CDPH will continue to recommend masking. In order to continue maintaining our progress with this pandemic, it's vital that we must continue to work together to increase vaccination rates in every age category across every demographic. But in the meantime, it's important for us to recognize this moment for what it is: a huge step forward in our effort to overcome COVID-19. We would not have been in a position even a few weeks ago to be making this kind of announcement today. There are a number of people we have to thank for getting us to this point. First of all, starting with the residents of our city, including as well Dr. Arwady and her team at CDPH, who remain an incredible force at the forefront of everything that we are doing to keep people safe, save lives when it comes to COVID-19. And I must also give a huge thank you to the many community leaders, the local healthcare organizations, particularly the federally qualified healthcare centers, who have been on the ground since day one and who have done tremendous things to support and uplift the quality of life, the health and safety of residents across our city, as well as those in the hospitality industry who have complied with our citywide vaccine mandate to mitigate the Omicron surge. And for the bar and restaurant owners specifically, especially those smaller neighborhood locations, I know that this mandate was particularly challenging for you. Challenging to enforce, challenging on your bottom line, and we will continue to make sure that we partner and collaborate with you on every step of the way going forward, as we have over these last 2 years. But thanks to your compliance, we are able to keep people safe, bump up our vaccination rates, and keep our economy open. And last but not least, I want to give a hearty thank you to all of our residents who cooperated in these mitigation efforts and gotten themselves and their loved ones vaccinated. Now, before I close, I want to keep a couple of other important points in mind. When Chicago makes this transition on February 28th, many residents may continue to wear masks in public spaces for a variety of reasons, even if they are vaccinated or as more mandates and advisories fade. Some may be compromised in their immune systems or have a family member that is. Others may be too young to get vaccinated, or some may just simply feel safer wearing a mask. Also, some venues may continue to impose their own mitigation efforts to keep their clients and customers safe. That is their right, and we must respect it. All this is to say, folks, be kind and conscious of your fellow neighbors and any decisions that they make for themselves to feel comfortable and protected. Our sense of togetherness as Chicagoans is, after all, what has made us who we are and what has gotten us through these last 2 years. And I have no doubt that it'll be what gets us out of this as well. And while so many things about this virus and the variants have been unpredictable, as I've stated before, my goal is to make sure that we never have to shut down our economy again. Now, I don't sit here with a crystal ball and able to predict what the future is, but I feel very confident that we are on the right path, that we're moving in the right direction. But make no mistake, I will not hesitate, nor will Dr. Arwady, to take the steps that are necessary to protect lives in this city. We have that obligation, and we will do that as best we can. But using the same guidance, being transparent, treating you like adults, telling you the truth, and giving you an opportunity, all the relevant stakeholders, to weigh in before we move. But this is a good news day for us because we're seeing ourselves on the downward slope of this Omicron surge. And with that, I'd like to welcome up Dr. Arwady.
Thank you, Mayor Lightfoot. It is a good day. I'll be sharing some of the data for why I feel very confident that, in fact, we are right on track with being able to lift those mitigations on the 28th, as you heard. So first of all, as a reminder, these are the 4 main metrics we've been following all along: cases per day, positivity, non-ICU beds, and ICU beds. I want to point out that these are 7-day rolling averages. So when we hit our benchmark, it means that's been the average over the past 7 days. So I told you last week, if we were within a day or two, we would want to go along with the governor to be consistent. But in fact, we hit having 3 of those metrics in low transmission yesterday on the 21st, meaning last week we were in that range, and we've got 1 week to go through the 28th. So in fact, we're hitting it right on time. We continue to have cases currently at 283 being diagnosed per day, balanced out by a very low positivity of 1.5%. In terms of hospital census, we're at 239 across the city and continuing to decrease. In ICU, another 80 and continuing to decrease. If we look at where we were, our peak of the Omicron surge, we had more than 10,000 cases diagnosed in one day here in Chicago. That doesn't even count home tests. That was just at the very end of December. So the fact we're in a place 2 months after that to be able to lift these mitigations safely, I'm really pleased with. You can see just a week ago we were at 431 cases, and then now to the 283. Similarly, our test positivity peaked on January 2nd at 20.3%. A week ago, we were down to 2%, now at that 1.5% with very high testing rates here. Similarly, we had more than 1,600 Chicagoans in the hospital. Last week, we were at 376, already down to 239, just in a week and dropping fast. And ICU, you can see the continued progress there. So I want you to know that the risk and being able to lift these mitigations is because the risk now allows it. So where we look at cases, for example, and you see that huge improvement. Some people have been asking me about the Omicron BA2. Yes, we are seeing that tailing off a little bit in the decrease, but cases are still down 37% from where they were a week ago. Things are looking good, and we make decisions based on what we're seeing right now while we continue to monitor for variants. To put this in some perspective, when we are seeing this many cases per day diagnosed using the estimates of how many go undiagnosed or are tested at home, we're now at a point where in a gathering of 50 people, there's only about a 1 in 5 chance that one of those 50 people would have COVID-19. It doesn't mean that they would spread it necessarily in a highly vaccinated setting, but that risk is down from about a 1 in 2 chance just a week ago. If we look at a 25-person setting, like for example, many of the smaller gatherings that we have, there we're down to about a 1 in 10 chance that one of the people of those 25 could be positive for COVID-19. So highly vaccinated settings, of course, remain safer, but that risk is down to a point where it is appropriate to lift the mask requirement and the vaccination requirement for high-risk settings. Here's what our test positivity looks like. Again, you see that continuing to drop really nicely, although it is tailing off a little bit as expected. Here's what the hospitalizations look like, dropping very, very fast. This is new hospitalizations every day. We had almost 300 Chicagoans being hospitalized with COVID in early January each day. Now we're at a 10% of that, 27 per day. And I want to make the point that the reason that we put that vaccination requirement in place for high-risk settings was mostly because of this, because we had more Chicagoans hospitalized during the Omicron surge than at any prior point in the pandemic. Almost all of those folks were not vaccinated. Many of them were younger. And so protecting our hospitals was why we made that decision to do approximately the 2 months of the requirement. Where we look at hospital census, that's falling quickly. You can see we have 17% capacity right now in our non-ICU beds. That's very good. And in our ICU beds, 22% capacity. That's great. So lots of space. We're in a good place. I do want to emphasize that getting vaccinated, even now, as the risk is falling, remains the most important thing that you could do. This graph we've been showing you week after week shows what the case rates look like in red there in unvaccinated Chicagoans, in light blue in vaccinated, and in dark blue fully vaccinated and boosted Chicagoans. And we've been updating this so that this isn't even reflecting the peak of Omicron. This is just since last January. Still in Chicago, 2.5 times more likely to be diagnosed with COVID if you are unvaccinated versus vaccinated and boosted. Gets even more for hospitalizations. Look at that huge spike in hospitalizations in red. That's the unvaccinated. If we could turn all of that red into blue, we wouldn't need to shut anything down again. We probably wouldn't need to put these masks on. Turning this vaccine into turning this disease into something endemic that we can live with, the quickest and safest way to do that remains through vaccination. And we're going to continue to encourage everybody, if they're not up to date with their vaccines, to get there. And then finally, where we look at deaths, we are averaging 4 to 5 deaths every day right now in Chicago, down from 9 to 10 just a week ago, down from, at the beginning of COVID, we had as many as 50. So we've not seen anything as bad as that. But again, just during the last 4 weeks, 12.9 times more likely to die if you're unvaccinated versus vaccinated and boosted. And you see how in the Omicron surge in the blue there in Chicago, we saw almost no increase. We're never going to get rid of COVID most likely, but if we can turn it into something that looks like the blue lines there, it's something we can live with. A couple more facts for you. 7,459 Chicago residents have already died as a direct result of COVID-19 infection. 7,459. And 862 of those, and counting, have died just in 2022. We're not even 2 months in. The great majority of those unvaccinated. In contrast, although I continue to hear misinformation stating the opposite, 0 Chicago residents have died as a direct result of COVID-19 vaccination. 7,459 versus 0. Please don't take a chance if you haven't been vaccinated yet. Even as the risk comes down, it's the time to do that. We have hit some nice benchmarks this week for vaccination. We crossed the 50% mark for our 5 to 11-year-olds. Now 50.3% of Chicago's 5 to 11-year-olds have had a first dose. That compares to only 32% on average across the U.S., so we're doing nicely there. We also hit 80% of our 12 to 17-year-olds have had a first dose, compared to 67% across the U.S. And for the first time, those teenagers got ahead of the 18 to 29-year-olds. So well done to the 12 to 17-year-olds. Of course, high vaccination rates most allows our younger kids to be gathering safely and doing all the things they need to do to develop as kids. I also want to point out that we did actually see quite a bump with the indoor vaccination requirement in high-risk settings in early January. That yellow arrow is where that went in. And you see how in the dark blue and the red, that's the 18 to 29-year-olds and the 12 to 17-year-olds, as well as the light blue, 30 to 39. We saw a nice uptick there. But again, the main purpose of the vaccination requirement was to limit people from going to the hospital, and that would be the setting if we got into trouble with hospitalizations in the future, that we would consider having to put that back on again, hoping we will never need to. If we look by race ethnicity, we've also hit 61% of Black non-Latinx Chicagoans have had a first dose of COVID vaccine, still lagging behind the other race ethnicities, but we've hit an exciting benchmark that a Latinx Chicagoan is now just as likely to have received a first dose of COVID vaccine as a white non-Latinx Chicagoan. And if we look at that, you see the blue line is Latinx, where the yellow arrow is, it's now come up to match the white, both at 75%. So 3 of 4 of all ages have now had that first dose. So thanks to all the partners, everybody who's been working hard on this. There are a lot of very young Latinx children in Chicago, so I expect to see that number continue to increase as more kids get vaccinated and as the younger kids are eligible, but that's a nice benchmark. I just want to remind you, we of course have plenty of appointments available around the city. You can walk into pharmacies. Our family vaccine clinics this weekend are at Truman on Saturday and Malcolm X on Sunday. We continue to do hundreds of vaccinations here. Adults, kids, boosters, come on out. We'll take you as a walk-in. And finally, our Protect Chicago at Home program, still going very, very strong. It is not stopping. 7 days a week, Monday through Sunday, 8 a.m. to 6:30 p.m., we will bring vaccine to your home. Anybody over the age of 5, first dose, second dose, or a booster, and there is the $50 incentive for the first and second doses. So give us a call, as always, where you want to get that. The last thing I want to say is a reminder that if you are over 65 or you have an underlying condition and you test positive for COVID, even on a home test, please give your healthcare provider a call right away. There are treatments available, IV treatments, oral treatments that can help keep you out of the hospital. You're eligible for them whether or not you are vaccinated. They are free. They are provided by the federal government, organized by IDPH, but you have to see your doctor, your healthcare provider, to get one. So they're available in Chicago, and we need people to call because it's too late if you wait 2 weeks and you're not doing well to get those treatments to help keep you out of the hospital. As always, if you need a vaccine or a booster, you have questions about testing, about treatment, anything, chi.gov/covidvax or 7 days a week, 312-746-4835. And with that, I'll hand it to Dr. Luna for some comments in Spanish and then back to the mayor. Thank you.
Thank you, Mayor. Thank you, Dr. Arwady. Y muy buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y tengo unos anuncios que hacer el día de hoy. Primero que nada, muy buenas noticias. Hemos anunciado hoy que la ciudad eliminará los requisitos de máscaras y vacunas para ciertos los requisitos de máscara y la certificación de vacunación para ciertos espacios públicos el 28 de febrero para alinearse con los planes previamente anunciados del Estado de Illinois para levantar el mandato estatal de mascarillas en interiores encerrados. Entonces, eso es importante saber que las métricas que avalan estas decisiones están donde hemos querido que estén. La clave de la ciudad está utilizando estas métricas para rastrear los casos de capacidad hospitalaria, y hoy nos encontramos en lo que es el riesgo comunitario menor. También estamos mirando la seropositividad y las camas de intensivo, y hoy nos encontramos en un lugar donde se beneficia la toma de decisiones que estamos decidiendo. A partir del 21 de febrero, esto se encuentra en la categoría de transmisión inferior y baja. Los casos de COVID-19 siguen en disminución en la transmisión sustancial, pero siguen moviéndose rápidamente. Hoy tenemos menos de 300 casos. Recuerden que requiere 200 casos para moverse a la transmisión baja e inferior. Se seguirán requiriendo máscaras en entornos de atención médica y en el transporte público y en otros entornos de congregación considerados alto riesgo. A medida que la ciudad realiza la transición de las medidas de mitigación para eliminar el requisito de la máscara, muchos habitantes de Chicago podrán continuar usando estas medidas de prevención en espacios públicos y en espacios interiores encerrados por varias razones, inclusive si no están vacunados. Las recomendaciones de enmascaramiento siguen vigentes como parte de las pautas de cuarentena. Además, alguien que puede estar inmunocomprometido podría preferir usar la máscara, o si también tiene un familiar que esté inmunocomprometido. Así que tenemos que ser respetuosos cuando estemos juzgando a los demás. En nuestros residentes menores de 5 años, recuerden, todavía no son elegibles para la vacunación, y la mejor protección es que todos los que sean elegibles estén vacunados. Sea amable y consciente de sus compañeros en Chicago y las decisiones que toman para protegerse a sí y a las personas que les rodean y que aman. Y recuerde que aunque vamos en la dirección correcta, la pandemia todavía no ha terminado. Nos movemos rápidamente a lo que es la prevención y vivir con la enfermedad, o sea, la condición endémica del COVID-19. Y para aquellos que no sepan lo que es endemia, es que se queda permanentemente con nosotros a un grado que podemos controlarlo. La vacunación sigue siendo la mejor manera para protegerse así a su familia, aún en esta nueva condición endémica. Estamos juntos en esto. Así que gracias y cuídate, Chicago. Y le paso el micrófono a la alcaldesa y a la doctora Arwady.
All right, we're happy to take your questions.
Thanks a lot, Mayor. We're going to kick it off with Chris Ty from CBS. Go ahead, Chris.
Yeah, Mayor and Dr. Arwady, either one of you could take this. What messaging are you sending to private businesses who are trying to grapple with what to do here? Obviously, you're giving them the green light to make the decision on their own. But if it's a school, a college, whatever, what kind of messaging are you giving to those institutions?
Well, I think it's pretty straightforward. We put these, particularly the indoor vaccination requirements in place in certain recreation venues, because of the huge surge that we were seeing. Because we're now on the downward slope of that surge, we don't believe that there's any further need for these mandates, but it's up to the individual businesses to make a decision on how they want to move forward. And I fully expect, based upon conversations I've been in, correspondence I've seen, that some are just simply going to keep enforcing, whether it's a mask mandate or the vaccination themselves, but that's their choice, and obviously that's their right.
And does this in some way feel like the end of the line from a very, very long 2-year cycle? What are you feeling right now?
From your lips to God's ears. I mean, we really don't know, is the honest truth. We are, and CDPH is constantly diligently looking to see if there's any other variant on the horizon. As I said before, I can't look into a crystal ball and tell you specifically, but the answer to all questions regarding the pandemic is vaccine, vaccine, vaccine. It will make us safer if more people are vaccinated. Doctor already shared with you kind of the current state of play when we're seeing vaccinations across ages and demographics. There are some places, obviously, where among some groups, we're doing quite well. There are others where there's a lot more progress that needs to be made. And we're continuing to be diligent in taking that message to those communities and literally continuing to go door to door to door to really make the case. And I think the vast majority of people who haven't been vaccinated yet, at least our surveys tell us, is they're not a hard no. There's some that are. The vast majority are still scared. They need more information. They want to know somebody in their family, in their community that's been vaccinated. So we're working to really break through those barriers. But our mission on getting as many people vaccinated in the city is really, really clear. And if we do that, then we're all going to be safer.
Amy Jacobson, 560 AM.
Hi.
You're going to ask me about the game tomorrow between Kenwood and Whitney Young and the girls' regional?
No, I was going to ask you about the Amundsen Walter Payton Prep Regional at Walter Payton High School. I have 2 questions for you, Mayor. One, now that unvaccinated firefighters and EMT as of February 28th can go to restaurants and go to gyms, when can they get back to work?
If you're an employee of the city of Chicago, you need to be vaccinated.
And you're not budgeting?
We're not changed that one bit. The rule's been very clear. We announced in August. We gave ample opportunity. If you're a city of Chicago employee, you need to be vaccinated.
Okay. Liberty Justice Center filed a lawsuit.
Yeah, and let me just say, particularly people who are involved in administering health care. Those EMTs that you reference, they're going out to calls. When people have a medical emergency, they need to be vaccinated. People calling are assuming that the people who are coming to render them treatment are doing so and exercising the utmost safety themselves and not putting the people who are calling for assistance at risk, which is why we need to get those folks vaccinated.
Liberty Justice Center filed a lawsuit, now a motion for preliminary injunction over the city and county's vaccine passport orders on behalf of 8 Chicago and Cook County residents. The suit alleges that the order violates the plaintiff's constitutional rights, Illinois law, and Chicago Municipal Code. Are you ending the Vax passport order because of this lawsuit? And
No.
what is your response to the plaintiff's claims?
Absolutely not. Every time a challenge has come against what we've been doing, those challenges have been denied by every court that's heard them, state or federal, but I'm not going to comment on the particulars of that lawsuit. We follow the data and the science. Look, I'm a 30-plus year litigator. I'm not afraid of a lawsuit.
Craig Wall, ABC7.
Mayor, first of all, let me just ask you, what are your plans going to be once this mandate is lifted? I mean, are you going to be out at restaurants without a mask? Will you be involved in things where you're not wearing masks, or are you going to keep wearing it?
Well, certainly in the short term, I'm going to be wearing a mask. That's my personal choice. I was one of the people that caught COVID during this Omicron surge, and while I had a mild case, I don't want to put myself at risk. So and particularly in a restaurant setting where I have no idea now, knowing whether or not the people that are sitting in and around me are vaccinated, I'll be wearing a mask.
Perhaps this is a question for Dr. Arwady, but you can answer it as well as you want. If you're holding out the possibility that if things surge again, we could have to take further mitigations, have you established what those metrics might be for having to reinstitute?
They're always the same metrics. They've been the same metrics from the beginning of the pandemic, what we just talked about. We're not wavering and picking and choosing what the metrics are. They're always the same. Cases, positivity, and what's happening with our healthcare system. Go ahead.
Yeah. So, my expectation really as we come off the Omicron surge is that not just here, but across the country, people are looking at metrics. They are looking at what does it mean to be burdened as a community, to the point especially where you threaten your healthcare system. So you've heard me talking a lot about the hospitals and the healthcare system because that remains the biggest concern, not just here, but around the country. And so we're not going to get into specifics today, but we will continue to follow, similar to the same metrics. I do expect the CDC to likely announce some updated guidance there, probably in the next week or two. And I would expect that we would be broadly going along with that as we have to date. And probably there will be a little bit less focus on the case numbers because already we're testing 3 and 4 times the numbers that we were last summer. So one of the reasons why we see cases and positivity so far apart from each other is we're a setting that tests a lot. There are some parts in the country that don't test a whole lot, so their positivity is higher, but their cases may be lower. We'll be looking at this like we do influenza, is my expectation. So,
Are you anticipating a surge when you stop wearing masks?
So, if you remember, the last time when we were able to remove the masks was last spring for the first time, right? As we were coming into phase 5, before we'd seen variants, we were able to fully reopen. And at that point, in the same way that we got a little bit of flack for saying when we're open, we're open. We're going to go ahead with Lollapalooza outside, although we were going to have a vaccination requirement, et cetera. When the metrics suggest that we're in a place where we can be open, we will be open. That is fully the expectation. I'm very confident that the next short while here is likely to be reasonably calm. We were hit very hard with Omicron. We saw a lot of people get vaccinated. We saw a lot of people get infected. And the combination of those two increases our immunity overall. But what I can say is about every 3 months around the globe, we've seen a new variant emerge. Would we be lucky enough to not see a new variant emerge? It's possible, but I think it would be foolish to say we would never expect to see another variant. The vaccines look great, and there's some new science out suggesting that they remain protective. I don't think we're going to be doing a 4th dose and anything like that for months, if even ever. So I certainly am feeling way more confident than I have at any point previously, knowing that the vaccines work as well as they do, even when they're not a perfect match to Omicron. They should continue to protect against future variants, but I can't fully predict the future. But I can say we're in a good place. We'll continue to make decisions based on the data and the risk, and do everything we can to not have to put stricter mitigations in. Since we reopened fully last April, as you know, we've actually not closed anything. We've not put any capacity limits in. One of the ways we've been able to do that is during the surge, have the indoor masks, and then during the big surge, have that indoor in the high-risk setting vaccination. But we're at a place where those can be lifted at the city level. I, of course, remain supportive of the individual businesses and other settings that choose to continue them, particularly in the short term.
Thanks, Doctor. Craig Dellamore, please.
And Doctor, if you could stay there for just a second. I want to ask the what could go wrong question, which is, aside from another variant, are there behavioral things or other things that could put us on a wrong path that people should be wary of?
Absolutely. So we always expect, as we lift some mitigations, that we'll see a little bit of a resurgence. One of the reasons why we don't want to move too soon is to make sure that at the time that we lift that, we can tolerate a little bit of an increase there. I think it's going to be really important that people, first of all, continue to stay home when they're sick, or at least until they've had a negative COVID test. I have a little bit of a cold right now. I don't have COVID. I took a test this morning. I've been extra careful wearing my mask because I don't want to spread the cold I got from my 3-year-old nephew. I do think people will continue to be masking, hopefully, to prevent even the colds that are spread. I also just want to make the point that the masks will not go away entirely. In addition to these settings, remember, isolation and quarantine. If somebody is diagnosed with COVID, you got to stay home for those 5 days. Days 6 through 10, you gotta wear the mask, right? Same thing for quarantine. So it's not like a light switch where there will be no masks of any kind. I hope that people will continue to take the care that we've seen Chicagoans do well with. Staying home when you're sick is a big one. Getting vaccinated and staying up to date with your vaccine, getting that 3rd booster if you haven't. And then we'll keep updating the data. We'll keep sharing with people. From my standpoint, we'll probably be in a higher risk or a lower risk setting. And while we're lower risk, Individual folks will be making the decisions they're making. If we unfortunately get back into a higher risk setting, we have to do something, we would. But my very strong hope would be, at least for some months now, we're good. And in a best case scenario, we don't see additional large surges. But I never predict more than months in the future.
Thank you. Mayor, let me start us off on this topic. I want to talk about the gang asset forfeiture. Obviously, there are more people expressing concerns about it pretty much daily. Some that there's no guarantee of a legal representation. You know what the objections are. Are you still going to go forward when so many people are saying that at the very least there need to be big changes, and at most that it's still a waste and beyond and won't be helpful?
Well, the answer is yes. We have listened a lot. We've made changes to the ordinance as a result of the feedback that we've received. But what you're not hearing is what I hear almost every time I'm out in community. Save us from these gangs. Do something to stop this violence that is terrorizing our neighborhoods. Do something to help prevent the wanton spraying of bullets on streets, in parks, and neighborhoods. That's what's in my head and what I hear on a regular basis. And I appreciate the concerns, which is why we will be filing complaints in court, where a judge will be the arbiter of whether or not we mustered the facts and the law to be able to make our case. That's very, very different from before. So I'm a lawyer. I trust the judicial system. I don't always agree with every decision that comes down the pike, but we're going to be in a court of law. Those arguments will be made, and I don't have any doubt whatsoever that a defendant that we name in a lawsuit is going to have representation, probably from some of the same voices that are raising concerns now. And we will be put to our test, and we accept that burden and that responsibility. But as mayor, I can't sit idly by and watch the level of gang violence that we've seen and not do anything. And what I'd like the critics to answer is to answer the call and the cry and the plea of people in neighborhoods that are under siege by gang violence. Tell them why we should not take away the profit motive of gangs who are killing our children, who are killing our elders, and who have no regard for the sanctity of life. I need them to answer those questions for those residents who feel victimized every single day and captives of gang violence. We have to step up and do everything that we can to keep our residents safe. This is another tool in our toolkit that I think is absolutely essential for us to be able to move forward.
Thanks, Mayor. Mary Ann Hernandez.
Can we just get one more time, where do we stand with CPS? And I thought Pedro Martinez was going to be here.
No,
today. Oh, okay. He was listed earlier on the.
Yeah. CPS is obviously aware of the decision that we're announcing today. They are in a process of engaging with their stakeholders internally and externally, and I would expect an announcement from them in the coming days.
So for now, CPS students must wear masks.
Yeah, I mean, everybody needs to wear a mask till Monday the 28th. We haven't lifted it spontaneously as of today. So that mask mandate indoors remains in full force and effect until the 28th. You want to jump in?
Yeah. I would just add, obviously, there's a lot of conversations, not just with CPS, but with schools across the city and across the country. Again, we do anticipate likely some newer CDC guidance coming shortly. I will tell you in an unofficial way at this point that vaccination rates are the things that I have the most concern for, where you have settings or schools or networks that have very low vaccination rates. That would be where we would expect to see more trouble. Where you've got a school that's 90% vaccinated, of course, that would be a setting that would be relatively lower risk. So CPS will be able to, make some of those decisions, but we will be obviously continuing to consult with them, just as we do all of the other districts and the other schools here in Chicago.
And have you seen the B2 variant in Chicago, and what do you notice about it?
Yeah, we have. We first detected it I don't know, at least a month ago, maybe more. And we've not seen it significantly at this point outcompete the original Omicron. So we're watching. And what we've seen with the BA2 is that it's kind of behaved differently in different countries. So it is the majority strain in South Africa, but South Africa's cases look fine. In Denmark, it sort of made it higher. The UK, the hospitalizations look fine. So I don't think it's Japan's having a little more trouble. So I don't think it's an open and shut case in terms of what happens with that, but we make decisions about mitigations based on what is the risk right now in Chicago. And so right now, with the risk being at a point where we can lift these confidently, that's what we'll be doing. And obviously, if we were to get into significant trouble, I don't expect it, but if we were to get into significant trouble and we needed to adjust again, we would. But I feel quite good, really, about where we are. We're doing better than most of the state, and the state's doing better than most of the region.
Heather Sherwin, WTCW.
Hi, Mayor. After the governor announced that he would lift the statewide mask mandate on February 28th, you said Chicago needed to be at the lower risk or the low risk status for 14 days. Chicago won't meet 14 days as of Monday. Why go sooner than you originally said?
Yeah, I'm not sure that's correct, but go ahead, Dr.
Let me hit it. Yeah. So when we report out on our metrics there, that's actually a 7-day rolling average. So when we're at, whatever it was, I think 280 something or 230 something for hospitalizations, that is the average over the prior 7 days. And so for those 7 days, we've been at that average, and then we're 1 week to the 28th. That's what I was saying last week. If I wasn't sure we'd be exactly there. If it was the difference of a few days, I didn't want to confuse folks. But we have been averaging under the metric over the last week, and I expect that to continue for the next week.
Back to the gang asset forfeiture ordinance.
It's called the Victims' Justice Ordinance.
I spoke with Pastor Marshall Hatch this morning, and he several weeks ago said he thought that this measure would undermine efforts to rebuild trust between Chicagoans and the police department. I spoke with him this morning and asked whether he had heard anything over the weeks of debates to change his mind about that, and he said that he didn't. He said that he thought it would exacerbate inequality on Chicago's south and west side, because he said he couldn't imagine something like this being used to address gangs on the north side or the far northwest side. How do you respond to that, and are you concerned that the passage of this ordinance will make it impossible for Chief David Brown to achieve what he said was his main goal this year of restoring that trust?
No, I don't have any concern about that whatsoever. Look, I have a great deal of respect for Pastor Hatch. I've known him for a long time. We've worked on a number of different matters. But the fact of the matter is, whether it's in West Garfield Park, which is where his congregation is located, whether it's in Little Village, and pick the neighborhood on the south side, there are entrenched gang cultures that are not only contributing to significant spikes in violence that I know Pastor Hatch is spending every single day working to fight against, but they are luring our young people into a gang life that is dangerous and oftentimes leads to death. So I'll say what I said in answer to the earlier question. We have to respond to what we're hearing from residents, which is that they feel afraid to leave their homes, and many in their homes, because of the grip of the gang culture. And I'm not talking about the guys on the block. They're not the ones that are getting rich. There are people in hierarchies and gangs that are making enormous amounts of money at the expense of the lives of residents in our city. We must stand up and be unified against them. Our common enemy in this public safety fight are gangs and guns and the longer term issue of poverty. And as to gangs, we've got to strike a hard blow against them. We've got to demonstrate to our residents that we hear them, that we understand what their daily challenge and burden is, and that we're doing everything possible to fight against these gangs. And the profit motive is huge for them. I'll remind you, CPD and its federal and state partners took off over $26 million in U.S. currency just last year. And that is consistent over many years And that's clearly the tip of the iceberg. And when you calculate out the street value of the drugs that have been seized, it's almost $500 million just last year. So anybody who says there's not a profit motive, anyone who says that we shouldn't go after and undermine that profit motive isn't looking at the data, but more to the point, isn't reflective of the lived experience of people in our neighborhoods who feel like their lives are being taken away from them because of the gangs. We have to go after them with every legal tool in our toolkit, and I believe that this ordinance will give us the ability. It's already sanctioned under state law. It's already sanctioned under state law. So what we're doing is proposing to take the state law that's been in existence for quite some time and codify it here in the city of Chicago. And I feel very confident about our ability to do that. We're going to continue to work with our local stakeholders. And again, I have a great deal of respect for Pastor Hatch, but I, as the mayor, I've got to do everything possible to keep people safe and save lives. Just as we've done through the pandemic, we must do the same thing with community safety, and this is a necessary and important tool in that direction.
Thanks, Mayor. Coco from Cinevision.
Hello, Mayor. After 1 week, have you considered appointing an Asian alderman for the 11th ward? And what is the appointment process like? Thank you.
We'll be making an announcement on that shortly.
That's right. Thank you very much.
Thank you.